ning tawringai manungda tracking bag amaga backpack amaga bag ani mafam khangdana mangkhre bag aduda medical report original documents pan card amadi firol ga konana sanasu yaukhre bag asi kanagumana thengnabirabadi pau pibirau adomgi tawbimal kaujaroi haijariba ingudam navakumar father of ingudam memsana sagolban tera yengkhomlerak Imphal West Langol View Charitable Clinic haina khangnaram mafam asi Lamjingba Hospital and Medical Research Institute Private Limited haina khangnarakani mafam asida medicine gynecology surgery orthopedic ENT amadi pediatrics ka mari lenaba analayingi service singi khudong chawa lobiyo akupamarol gidama contact tobiyo Lamjingba Hospital and Medical Research Institute Private Limited RIMS Southgate near Kombire Kaithel Hospital helpline
First, the headlines. AAI Imphal Airport to test preparedness for resumption of flight operations. Assam records 266 COVID-19 cases. Their toll stands at 4. And India records another biggest single-day spike in COVID-19 cases. Tally rises to 1,25,101. Hello and good afternoon. Welcome to Times of Manipur. You are watching News Today at 1 p.m. and this is HARIPRIYA giving you the news in details. Airports Authority of India, Imphal International Airport will put to test its preparedness for resumption of flight operations at 2 p.m. today. According to a release from Airports Authority of India, Imphal International Airport, all stakeholders will take part in the exercise. It underlined on the need of sanitizing every passenger in particular and the people in general on the do's and don'ts in the wake of deadly COVID-19 pandemic and other contagious diseases. The number of COVID-19 positive cases continue to rise in Assam. In the biggest single-day spike, the state has reported 26 fresh cases. According to our Guwahati correspondent, the number of anti-COVID-19 teams has been increased in various districts of the state. The authorities are also making efforts to increase the number of quarantine centers in all the districts. So far, the COVID-19 tally has reached 266 in Assam, out of which 198 are active cases. 54 have already been discharged, 4 have died of the disease, and 3 have migrated, official data said. India today reported another highest single-day spike with 6,654 new cases of the coronavirus disease COVID-19 in the last 24 hours, taking the infection tally to 1,25,101 according to data released by the Union Health Ministry. This is the second time in a weekday the tally of COVID-19 cases has surged beyond 6,000 and the third time that the country reported the biggest one-day rise in the number of infections. On Friday, 6,088 new cases were recorded and before that 5,611 infections were seen on Wednesday in the span of 24 hours, Health Ministry data shows. The death toll related to the respiratory disease stands at 3,720 on Saturday after 137 people succumbed in the last 24 hours, the Health Ministry's COVID-19 dashboard showed. The COVID-19 recovery rate has gone up to 41% as 51,783 people have been cured as the country entered the 6th day of the 4th phase of the lockdown, a media report said. According to government data released by NITI, Ayok member Binod Paul on Friday, lockdown 1 and 2 has managed to significantly slow down the virus transmission rate in the country and average between 1.4 and 2.9 million COVID-19 cases and 54,000 deaths. Over 5 million people have been infected with the novel coronavirus globally, including 338,183 deaths. US President Donald Trump has declared places of worship as essential places that provide essential services. A scuffle took place last evening at the Thoubal District Hospital premises following 4 individuals showing COVID-19 symptoms were brought at the isolation ward of the hospital, which can accommodate only 2 people. According to our Thoubal correspondent, the 4 individuals who returned home on 18 of this month are under quarantine in the institutional quarantine center at Waikomani Girls College. The incident occurred when the doctors at the hospital demanded that basic equipment and manpower should be provided to the hospital. A team of Thoubal District Police arrived at the scene and managed to control the situation. One of the doctors at the isolation ward said that the hospital has no sufficient number of doctors nor proper resting place for faculty members. Meanwhile, Superintendent of Thoubal District Hospital and other top-ranking officials held a meeting today to discuss the issue. The MIT decided to assign 12 faculty members to run the isolation ward at the district hospital. Phytol segment ADC member Halting Dongel today distributed 10 kg rice each to 95 households in Kamay village of Tamanglong district under NFSA and PMGKAY at the Kamay village community hall. Halting Dongel said that the rice has been distributed to the residents to help ease their sufferings during the ongoing COVID-19 pandemic crisis.
Sigi laina si ngathok na ba ekoi mayam na yum na leiraga isol bu khrumaga asigi laina sida ngathok na ba ekoi mayam nungai na wakhan pik loise DC na so ngamba mateng pire aduga staff mayam na so mateng pire MLM CM PM mayam na ekoi bu
Meanwhile, COVID-19 volunteers and Kamay Youth Club KYC urge all Kamay villagers to stay indoors in view of many buses carrying back stranded Manipuris through the national highway in the region. And now let's have a short commercial break. Do stay tuned for more updates.
Langol View Charitable Clinic haina khangnaram mafamasi Lamjingba Hospital and Medical Research Institute Private Limited haina khangnarakani. Mafamasida medicine, gynecology, surgery, orthopedic, ENT amadi pediatrics ka mari lenaba analayingi service singi khudong chawa lobiyo. Akupa marol gidama contact tobiyo Lamjingba Hospital and Medical Research Institute Private Limited, Rims Southgate near Kombire Kaithel. Hospital helpline number 8258967890.
Welcome back. In connection with Idul Fitr, Hayalabuk Jilla Parishad member KH Razmohan distributed essential commodities to 500 households of Hayalabuk today. Razmohan also wished everyone, especially the Muslim brethren, on the occasion for a peaceful and prosperous state. Cyclists and social activists Rohan Philem reached out to Singamayum Rajmudin, a bedridden man. Rohan presented him with daily essential commodities yesterday. Rohan's help came after Tom TV carried a story on the life of Singamayum Ramichudin. The 30-year-old has been bedridden for the past 8 years as his lower torso is completely paralyzed. Rohan Philem appealed to the concerned authorities, especially Moirang constituency MLA, to do the needful to help the helpless men. Managing Director of Saina Institute of Medical Science, Dr. S. Kumar extended his greetings to the people, especially the Muslim brethren, on the auspicious occasion of Eid al-Fitr. Dr. S. Kumar urged all to celebrate the festival by maintaining social distancing norms. Muslims across the world celebrate Eid al-Fitr or festival of breaking the fast to mark the end of the month-long dawn to sunset fasting of Ramadan.
Social distance biduna yum dagi papan thupidana yum da Eid al-Fitr it asibo pangthokpiu haijari government na silakba sigumba social distance thambiduna government da khoi punna mating pangminasi aduga Eid al-Fitr it asibo bung phana pangthokminasi haina haijari.
Prakash Singh Karki, a 43-year-old man from Uttarakhand's Bageshwar district, reunited with his family after over 2 decades. According to a media report, Prakash Singh left his residence in Ramadi village of the district some 24 years ago in search of greener pastures. He, however, returned home on May 18 last from Gujarat during the ongoing nationwide lockdown, and when he reached his village, the residents did not recognize him. Karki later revealed that he decided to leave home for work after passing high school in 1995. Jaliarong Students Union Manipur JASUM has appealed to all the school authorities not to charge school fees from students for the period of national lockdown which started in March 25 last. The union in the press release also urged the state government to arrange honorarium for the teachers of government-recognized private schools of the state, since schools authorities are not paying them. JASUM further lauded the state government for providing essential items to the people during the period of lockdown and urged the government to ensure whether the allotted relief materials are received by the deserving beneficiaries. The death toll due to cyclone Amphan in West Bengal has risen to 85, as angry Kolkatans resorted to protests and road blockades in various parts of the city over the administration's failure to restore normalcy even after 3 days, as per media reports. With normal life thrown out of gear by the region's worst weather disaster, the authorities scramble in various parts of the state to restore normalcy. West Bengal Chief Minister Mamata Banerjee is likely to visit Cyclone Amphan hit South 24 Parganas district later today and take stock of the situation. Even as the state continues to battle against COVID-19, Assam witnessed the first spat of floods of the year as 2 villages in Barbita were affected by the flooding. According to media reports, around 630 persons in 2 villages of the Kalgachia revenue circle of Barbita district have been affected by the flood. The incessant rain for the past 2 days due to Super Cyclone Amphan has led to the rise in water levels of many rivers, including the Brahmaputra. Meghalaya Chief Minister Conrad K. Sangma today visited the Batni Hospital, Shillong, which reopened after a month of closure following the detection of first COVID-19 positive case in the state. In presence of late Dr. John L. Silo Rintathyang's wife and other family members, Chief Minister paid tribute to Dr. Silo, the founder of Batni Hospital, Shillong, and joined the family in prayers. Chief Minister Conrad said thanked the entire Batni Hospital team who responded to the pressure in a positive and cooperative manner. He said that the biggest tribute to Dr. Silo will be for the team to continue with the good work and fulfill his vision for the people. Now do join Tom TV's new program, Your Voice, Adongi Konjel. Please express your grievances and issues through our channel. Send your audio or video to our WhatsApp number 9402491149 along with a copy of your Aadhaar card. Please mention your name and address properly. Be a citizen journalist. Let's listen today your voice.
ꯑꯩꯈꯣꯏꯅ ꯍꯧꯖꯤꯛ ꯂꯩꯔꯤꯁꯦ Bangalore gi Bellandur Koba mafam amada akhoi mioi khara leibani ngasiga anirak suna train da puthokiba haibasida akhoi gi maraktegi kanagumba amata list da yaukhiba leite mafam sida akhoi na kuina lerakpana maram moiraga awaba kharadi adumak mayoknari thengnariba awaba se kaningai gi damak haukhiba nimit kharani gi mamangda flight ki ticket ka khibada laukhiba paisa singna se akhoi gi account da sangningai gi damak mari leinaba department na amuktang Meeting Sangbiduna, Akoi ge account da Hariba Pesa Singadu, Sangak Ningai Damakta, Mating Krato Biohaina, Mishing Zeri.
Now let's have the further details. Even as medical journal The Lancet published a paper on Friday saying there were no confirmed benefits of anti-malarial drug hydroxychloroquine HCQ being given to COVID-19 patients, the Union Health Ministry issued an advisory expanding the pool of people to be given the medicine as a prophylactic to prevent from them contracting the infection. The Joint Monitoring Group and National Task Force have now recommended the prophylactic use of HCQ in the following categories. In Category A, all symptomatic healthcare workers involved in containment and treatment of COVID-19 and asymptomatic healthcare workers working in a non-COVID hospital, non-COVID areas of COVID hospital blocks. And in B category, asymptomatic frontline workers such as surveillance workers deployed in containment zones and paramilitary police personnel involved in COVID-19 related activities. And in C, asymptomatic household contacts of laboratory confirmed cases, the advisory said. And now let's see the newspaper headlines.
The Shanghai Express. Chief Minister appeals people not to panic, says government fully prepared. One more positive, taking total active cases to 24. Isolation wards to be opened in all districts. COVID-19 lockdown. 9 migrant workers sent back home. Government to study opening testing centers at MU, ICAR, IBSD. 230 more go back to Mizoram. The People's Chronicle. Evacuees to be sent to CQCs only after testing. Volunteers in quarantine centers to get SAM insurance with frontline warriors. Delhi returnee test positive. 24 active cases in state. Health Minister seeks ₹100 crore emergency fund. Churachandpur scribes to cease work, accused DC. District Police command Ukhrul Public. Imphal Free Press. Preventing community spread of COVID-19 is the primary task ahead, says Chief Minister Biren. Monkeys of Mahabali temple are intruding into houses out of starvation, say locals. Manipur Mail. Chief Minister appeals people not to panic. Government prepared to tackle situation. One more positive case. Health Minister seeks ₹100 grand from Centre to contain COVID-19. Biswajit chairs MFICL Board of Directors meeting.
Before we close, let's see the top news headlines once again. AAI Imphal Airport to test preparedness for resumption of flight operations. Assam records 266 COVID-19 cases. Death toll stands at 4. And India records another biggest single-day spike in COVID-19 cases. Delhi rises to 1,25,101. That's all for the moment. Thank you very much for joining us and keep watching Times of Manipur News Update and have a good day ahead.